I need you to stop whatever you are doing right now and listen carefully, because what I'm about to share with you today could literally add years to your life. And I am not being dramatic. After more than 40 years of practicing medicine, sitting across from thousands of patients, many of them over the age of 60, I have watched high blood pressure silently destroy hearts, collapse kidneys, and steal the independence of people who had no idea the danger they were in. But here's the part that breaks my heart every single time. Most of what I'm about to show you today, those patients could have done at home for free without a single pill. So if you are over 60, if your blood pressure has been creeping up, or if your doctor has ever said the words pre-hypertension or stage 1 hypertension to you, stay right here, because the next several minutes may be the most important thing you watch all year. Let me start with a number that should concern every single person watching this video. Nearly half of all American adults have high blood pressure. Half. And among people over the age of 60, that number climbs even higher. We're talking about nearly 70%. 7 out of every 10 people in their 60s and 70s are walking around with dangerously elevated pressure inside their arteries. And yet, and this is what I want you to really hear, the majority of them feel absolutely fine. That is why we call high blood pressure the silent killer, because it gives you no warning, no flashing red light, no alarm. It just quietly, day after day, month after month, thickens your artery walls, strains your heart muscle, and sets the stage for a stroke or a heart attack that comes completely out of nowhere. Now, I am not here today to talk about medications. I prescribe them when I have to. But I have seen time and again in my clinical practice that when patients start moving their bodies in the right ways, blood pressure responds. Sometimes dramatically, sometimes fast enough to genuinely surprise even me. Today, I am going to walk you through the top 3 exercises that have the strongest scientific backing and the best real-world results I've seen in my own patients for lowering high blood pressure naturally. These are exercises designed specifically for people over 60. They are safe, they are effective, and they are backed by decades of research. Let's get into it. Exercise 1. Slow, deep breathing walks. The moving meditation. I want to start with something that surprises almost everyone I tell it to: walking. Simple, ordinary walking. Now, before you click away and say, Dr. Mandell, I already walk, listen, because the way most people walk is not the way I'm prescribing here. And the difference matters enormously. So I had a patient, I'll call her Margaret, a 67-year-old retired school teacher from Ohio. She came to me about 3 years ago with a blood pressure reading of 158/94. Her doctor had already suggested starting medication, but she came to me first wanting to try a more natural approach. She told me, I walk my dog every morning, 45 minutes. Why isn't that helping? I asked her to describe her walks, and as she talked, I understood the problem immediately. She was walking while worrying, rehearsing arguments in her head, running through her grocery list, thinking about her grandchildren's school problems. Her body was moving, but her nervous system, her stress response, was fully switched on the entire time. Here's what most people don't understand about blood pressure. It is not just a physical problem. It is a nervous system problem. High blood pressure is in many cases a physical expression of a chronically overactivated stress response. Your sympathetic nervous system, your fight or flight system, is stuck in the on position. One of the most powerful switches to flip it off is something called slow diaphragmatic breathing, deep belly breathing. combined with gentle rhythmic movement. It's what I call the moving meditation walk. Here is how you do it. You go outside, or even walk in place indoors if the weather is poor. You begin walking at a comfortable, gentle pace. Not a power walk, not a race, a calm, unhurried pace. As you walk, you breathe in a specific pattern. You inhale slowly through your nose for a count of 4. Then you exhale slowly through pursed lips like you are gently blowing out a candle for a count of 6 to 8. Longer exhale than inhale. This is critical. That extended exhale directly activates your vagus nerve. And the vagus nerve is the master switch of your parasympathetic nervous system, your rest and digest system. Supplement. When that nerve gets stimulated, your heart rate slows, your blood vessels relax and dilate, and your blood pressure comes down. You do this for 20 to 30 minutes, 3 to 5 times per week. I told Margaret to try this for 6 weeks. Just this one change, same walk, different breathing. 6 weeks later, her blood pressure had dropped to 141/87. She was astonished. I was not. I've seen this pattern dozens of times. A landmark study published in the Journal of Human Hypertension confirmed that slow breathing at 6 breaths per minute, which is roughly what this pattern achieves, significantly reduces both systolic and diastolic blood pressure in hypertensive patients. And it works even faster in people over 60 because their blood vessels respond particularly well to parasympathetic activation. But here's what people get wrong. They turn on their podcast, they check their phone, they talk on the phone the whole time. When you do that, you're right back in your stress response. You nullify every benefit. The walk has to be somewhat mindful. Notice your surroundings. Feel your feet on the ground. Breathe with intention. That is exercise number 1. 20 to 30 minutes, gentle pace. Slow, deep breathing. Longer exhale than inhale. Do it consistently, and your blood pressure will respond. Exercise is just 2. Isometric resistance training, the wall push now. This one genuinely shocks people when I tell them about it. Because when most people think about resistance training and blood pressure, they think, isn't that dangerous? Won't lifting weights raise my blood pressure? And for many types of intense dynamic weight training, yes, there is a temporary spike in blood pressure during the exercise. That's one reason I'm very careful about recommending high intensity lifting to patients over 60 with hypertension. But there is a specific type of resistance exercise that does something almost miraculous to blood pressure, and it's called isometric exercise. Isometric means you are contracting a muscle hard without actually moving the joint. You're pushing against something immovable. No motion, just sustained tension. Supplement. The most well-studied isometric exercise for blood pressure is called the isometric hand grip. But for my older patients, especially those with arthritis or wrist problems, I prefer a modified version that works just as well, maybe better. I call it the wall push. Here is how you do it. Stand about 12 to 18 inches from a wall. Place both palms flat against the wall at shoulder height. Now, keeping your body completely still, push into the wall with firm, steady pressure, not a shove, a sustained push, like you are trying to move the wall, but you know you won't. You hold that push for 30 seconds, then you relax for about 60 to 90 seconds. Then you repeat. 2 minutes of total pushing, broken into 30-second holds, is the standard protocol used in research studies. Now let me tell you about a patient I'll call Robert, 71-year-old retired engineer. Stubborn as a brick wall, no pun intended. He'd been on blood pressure medication for 8 years and was frustrated that his numbers were still hovering around 150 50 over 90, despite the drugs. He came to me wanting answers. She introduced him to isometric wall pushes and two other isometric protocols, sitting in a chair, pressing his palms firmly together in front of his chest, holding for 30 seconds. Simple. He could do it while watching television. He could do it in 3 minutes. 8 weeks later, 8 weeks. His cardiologist called him and asked what he had changed. His systolic blood pressure had dropped by 18 points. 18 points. From medication alone, most patients see a 10 to 15 point drop. He got there with wall pushing and breathing walks. Science behind this is fascinating. A meta-analysis published in the British Journal of Sports Medicine, one of the most respected sports medicine journals in the world, analyzed dozens of studies and found that isometric exercise produces the largest reduction in resting blood pressure of any exercise type. Larger than aerobic exercise, larger than dynamic resistance training. The mechanism involves something called post-exercise vasodilation. After an isometric contraction, the blood vessels that were compressed during the hold flood open, they dilate dramatically. Over time, with repeated sessions, the walls of your arteries actually become more elastic and responsive. Stiffening that comes with age, which is one of the primary drivers of elevated blood pressure in people over 60, begins to reverse. What people do wrong is they do it inconsistently. 1 week on, 1 week off. It doesn't work that way. The protocol that produced results in studies was 4 sets of 2 minutes, 3 times per week for at least 8 weeks. You need consistency. You need to give your vascular system time to adapt the wall push. 30-second holds, 30-second rest, 4 sets, 3 times a week. Put it on your calendar. Make it as non-negotiable as brushing your teeth, because the research suggests this simple habit could mean the difference between a stroke and a full, healthy life. Exercise, Pi 3, Tai Chi, or slow, flowing stretching, the liquid movement. I want to tell you about the third exercise with a story years ago, and this was early in my career. Before I fully appreciated what I'm about to share, I had an elderly patient, a 74-year-old Chinese-American woman named Helen. She had been diagnosed with stage 2 hypertension and was already on 2 blood pressure medications. She was also dealing with significant joint pain and told me very clearly that vigorous exercise was simply not something her body could do anymore. I was prepared to adjust her medication protocol, but she mentioned almost in passing that she had started going to a Tai Chi class in the park near her home. 2 mornings a week. I nodded politely. I didn't say much. And I'll be honest with you, at that point in my career, I didn't take it as seriously as I should have. 3 months later, Helen came back for a follow-up. Her blood pressure was 128 over 82, on the same medications that had previously kept her at 148 over 96. She hadn't changed her diet. She hadn't changed her medication. The only variable was Tai Chi. That experience permanently changed how I counsel my older patients. And the science has since caught up completely. In a comprehensive review published in the journal Hypertension, the flagship publication of the American Heart Association, analyzed dozens of randomized controlled trials on Tai Chi and blood pressure. The conclusion was unambiguous. Tai Chi significantly reduces both systolic and diastolic blood pressure, with results comparable to moderate aerobic exercise. And critically, Tai Chi is safe for people with joint issues, balance problems, and limited mobility. It is one of the most accessible exercises for seniors that exists. Now, why does it work so powerfully? Tai Chi works on blood pressure through multiple pathways simultaneously. It activates the parasympathetic nervous system through its slow, meditative nature, just like the breathing walk. It improves what researchers call endothelial function, the ability of the inner lining of your blood vessels to dilate and contract properly. It reduces cortisol levels, the primary stress hormone that constricts blood vessels and drives blood pressure up. And it improves what cardiologists call arterial compliance, the elasticity and flexibility of your artery walls. For those of you who think Tai Chi is not something you can access, I hear you. Not everyone has a class nearby. But here's what I tell my patients. You don't need formal Tai Chi. What you need is the underlying principle. And that principle is slow, flowing, intentional movement, slow yoga, gentle Qigong. Even something as simple as standing in your living room, raising your arms slowly over your head on a long inhale, then lowering them slowly on a long exhale, repeated gently for 15 to 20 minutes, triggers many of the same vascular benefits. The key elements are slow, deliberate movement synchronized with slow, deliberate breathing performed in a calm mental state, not while watching stressful news, not while distracted. Just you and your body moving together like water. What most people do wrong is they look at this and think it's too easy to work. They want something harder. They feel like if it's not making them sweat, it can't be effective. This is one of the most dangerous health misconceptions I encounter in older patients. For a 60 or 70-year-old cardiovascular system, gentle, consistent, intelligent movement is often far more therapeutic than hard, sporadic, intense exercise. The intensity approach often spikes blood pressure during the session and leaves joints and heart stressed. The flowing approach brings the whole system into balance. 20 minutes of slow flowing movement 3 to 5 times per week. That is the prescription. So I want to take a moment here and speak directly to you, not as a physician right now. Just as someone who has spent 4 decades watching what happens when people get this right and what happens when they don't. So I have held the hands of patients who never got the chance to walk their daughter down the aisle. I have sat with families in hospital corridors trying to explain what a massive stroke does to a person's ability to speak, to remember, to recognize the faces of people they love. I have watched proud, strong, independent men and women lose the ability to live in their own homes, not because of cancer, not because of some exotic disease, but because of chronically elevated blood pressure that nobody took seriously enough early enough. And the cruelest part of all of this, so much of it was preventable. If you are over 60, you are not too old to change the trajectory of your cardiovascular health. I have seen it happen at 65, at 72, at 78. The human body has a remarkable capacity to respond, to heal. When you give it the right signals, your grandchildren need you present. Your partner needs you healthy. It's your independence, the ability to wake up every morning in your own home, drive your own car, cook your own meals, that is worth fighting for. And these 3 exercises are among the most powerful weapons you have in that fight. Please, don't treat this information like background noise. Print this out. Write it down. Share it with someone you love. Let me give you your prescription one more time clearly. Number 1, the breathing walk. 20 to 30 minutes of gentle walking combined with slow nasal inhales of 4 counts and extended exhales of 6 to 8 counts, 3 to 5 times per week. Number 2, the isometric wall push. 4 sets of 30-second sustained wall pushes with 60-second rest between sets. 3 times per week for a minimum of 8 weeks, numbers of 3, slow flowing movement, Tai Chi, gentle yoga, or mindful arm flows, 20 minutes, 3 to 5 times per week, synchronized with slow breathing. These 3 protocols practiced consistently can reduce your blood pressure by 10 to 25 points or more, without a single side effect, without a single pharmacy visit. That is not me being optimistic. That is what the literature shows. That is what I have seen. Now, if this video helped you, if something I said today made you think differently about your health, I need you to do something right now. Hit that like button. It costs you nothing. And it tells me that this kind of honest, practical, doctor-driven information is what you want more of, because I have a lot more to share with you. Subscribe to Longevity Lane and make sure you hit the bell notification so you never miss a new upload. Every single week, I bring you the kind of health information that most people only discover when it's already too late. You deserve to know this stuff now while you can still act on it. And leave me a comment below. Tell me, which of these 3 exercises are you going to try first? Or if you've already been doing one of these, tell me your experience. I read every comment. This is a community, and your story might be exactly what someone else needs to hear to take their first step. Your health depends on this information. Please share this video with someone you love who is over 60. Send it to a parent, a spouse, a sibling, a friend. You might just save their life. I mean that with everything I have. I want to leave you with one final thought. Every morning that you wake up is an opportunity to make choices that honor the extraordinary, complex, resilient body you were given. High blood pressure is not your destiny. Stiffening arteries are not an inevitable sentence. Movement is medicine. And the right movement done consistently, intention and breath, can change your body at the cellular level. I have seen it. The science confirms it. You are not too old. You are not too far gone, but you must start. Today, not Monday, not next month. Today, this is Dr. Mandell reminding you that a longer, stronger, healthier life is not just possible, it is within your reach. You just have to decide to reach for it. Take care of yourselves. I'll see you in the next video. If you care about your health, want to understand what's silently harming your body, and are ready to learn the truth about living a longer, stronger, and healthier life, subscribe to Longevity Lane with Dr. Mandell. Here, we reveal the health truths most people discover only when it's already too late.